Hello, my name is Franck Renouard. I'm working in Paris and I'm in implant field for more than 25 years. I'm very pleased to present to you today the 4 safety checklist. But before talking about checklist, I would like to give you some figures. Do you know that an airliner pilot, means a professional pilot, is going to do an average of 10,000 errors during his work career? 10,000. But in reality, the risk of having an accident when you take an airplane is very, very small. If you want to experience an airplane crash, you have to fly every day for more than 2,700 years. 10,000 errors, almost no complications. We have to try to understand this paradox. Because we, as clinicians, we also do errors, and probably more than 10,000 during our work career. But unfortunately, our errors sometimes continue to lead to complications. The pilot does errors without complication. The clinician does errors, sometimes with complications. Where is the problem? First of all, we have to understand why we do errors. Just because the brain is not a perfect machine. It's a very, very complex machine. But some factors, as the stress, the fatigue, the temporal pressure, or in another hand, the routine, lack of vigilance, all these factors can interfere in the decision-making process. It is why, even if we are very concentrated, sometimes we are going to do errors. Fortunately, most of our errors don't lead to complications. And this figure explains very simply why the same errors sometimes can have absolutely no effect, and the same errors in another context can have a dramatic consequence. It's the same in our practice. Imagine that you have to place 1 or 2 implants in the posterior mandible. The bone is very dense. The crest is thin. We do know now, because of literature, that we can place narrow implant. I start to place my implant, and during its insertion, the implant jams. I did an error. My bone preparation was not large enough according to the bone density and the implant diameter. But now I have 2 manners to react. The first, I apply the protocol. I remove the implant, I use a wider drill or a tap, and I replace my implant. The second manner to react, I'm very irritated. The patient was late, he didn't apologize, and now my waiting room is full of patients. The morning I had a problem with the staff. I want to end up the surgery as fast as possible. I take the manual wrench, I try to force the implant insertion, and I break my connection. I have 1 error and 2 different consequences. So why the pilots do errors, but in the same time have almost no complication? It's because during the last 40 years or 30 years, the pilot community has worked a lot on the detection of the menace, the different threats during the different procedures. The checklist is probably the most efficient way to avoid that an errors become complications. But you can see on this drawing that all these barriers have a black holes, which allow the errors to go through. And the worst checklist is a checklist you don't use. I would like to tell you a real story. The story of the cameraman. He has to make a movie, a film during a skydiver exhibition. He boards the airplane and he knows that everything is going very fast. He can do only 1 shot. And he focuses a lot on the material. He controls everything. He jumps out of the airplane without his parachute. So the checklists are crucial. We do know now we have a lot of publication in the medical field which demonstrate clearly that if you use a checklist, you are going to reduce the mortality and the morbidity of the treatment. Obviously, I know that in dentistry, the mortality is so rare event. But the morbidity is a very important factor we have to consider. If you use a checklist, you are going to decrease the cost of the treatment. In 2008, in the Michigan state, the physician has developed a very simple, very humble checklist to control the asepsis during the bypass preparation for the coronary examination. In 1 year, the state of Michigan has saved more than $170 million in 1 year. If you decrease the morbidity or mortality, if you decrease the cost, you are going to decrease, and we have publication, you are going to decrease the risk to have medical legal issue with your patient. Now we have the proof that the use of checklists in medicine improve the healthcare for a patient, but improve also the quality of the professional life for the clinicians and for the staff. And now we have new publications which demonstrate clearly that if we use electronic checklists, we improve again the effectiveness of those checklists. So it is why the FOR has decided to create his own checklist. And the FOR has asked a different clinician to work on a checklist from clinician to clinician. The first step to create a checklist is to gather a group of experts, and those people are coming from the different corners of the world, and they have a so vast experience, and they have worked together in order to create the most efficient barrier to protect you and your patient during your routine practice. Doing checklist is not so easy. First of all, you have to identify the different critical steps during a procedure. In our treatment, in our field of activity, we start by the clinical examination and we end up when we close the operating room. We have identified 7 steps. And then inside these different steps, we have to analyze and also to identify the different parameters, factors, actions we call items, critical. We cannot jump, we cannot forget. The third step, which was not so easy, was to create sentences which were understandable by everybody. Whatever you work in Asia, in Europe, Africa, America, you must be able to understand. Whatever is you are novice or expert, you must be able to understand. These sentences must be very clear without any possibility to misinterpret. And the last, but not the least, step was to create an application. Very easy application, user-friendly applications, and those applications must be used systematically by everybody in your clinic, yourself or your staff. So the next step for you will be to download. You go on the FOR website and you download the checklist. So far, checklists are only available for iPad and iPad mini. So now you have downloaded your checklist and you have just to click on Safety Check and the different critical steps appear. You have just to choose between the clinical pre-treatment consultation or the stock and material control or the operating room setup until the last one, the closure of operating room. Let's say, by example, the patient pre-operative steps, just before the patient installation. The first thing to do is to enter the name of the patient. You click and you place the name of the patient. And then you have to choose who is going to make the checklist. Yourself or member of your team, you can choose the different persons there. And then it's going to take 30 seconds to do the checklist. The first item, for example, is to control. Sign informed consent form in a patient field. I click once, it's okay. The second, sign financial estimate in a patient field. Okay. Normally, just 1, it's green, 2, it's non-applicable. And you see that when you end up your checklist, this little icon goes through red to green. Thank you for completing the checklist. And now the checklist is done. It needed maybe 30 seconds. 1 minute maximum for safety of your patient is almost nothing. And what it is done, you have just to click on export and a PDF of the checklist with the date and the name of the patient, the name of the people who has done the checklist, and the hour of the checklist will be sent directly in your computer to be stored in a patient file or to be printed if you need to print this control. And you can also click on the name of the checklist and you have some information. And the most important for us is to know what do you think about it. And if you endorse, you have just to click there, endorse it, and that will send a signal to the fore that you appreciate the checklist and you use it. And please let us know how do you feel with the checklist, and you can also send us directly through the application your feedback and your comment. Please keep in mind that the worst checklist is a checklist you don't use. I encourage you and your staff to use this very simple and very humble checklist all the time. Whatever your expertise, do you are novice or do you place a lot of implant, please use this checklist for your safety and for safety of your patient. Thank you very much and enjoy.